Welcome to the banker lamp. Please enjoy the video.
You start now by assembling sterile supplies and confirming the exact prescribed dose because accuracy matters for effectiveness and safety. Once gloves are on, cleanse the vial top and inject air to make drawing the solution easier. This prevents vacuum delay. Pull back the syringe plunger until you have the intended volume, keeping the needle submerged to avoid air bubbles. Make sure the measurement lines are read at eye level. Recap carefully, or switch to an injection needle if you used a transfer needle. You now find the deltoid by measuring 2 to 3 finger widths below the acromion process so you avoid the axillary nerve and bone. Once located, have the arm relaxed and resting. Tense muscles make injection painful and less effective. Clean the skin with an alcohol swab moving outward and let it dry to reduce stinging. Grip the syringe firmly and insert the needle quickly at a 90-degree angle. Aim for the central lateral muscle and stabilize the shoulder with your other hand to prevent movement. Once needle is fully seated, you inject the solution slowly to reduce pain and tissue trauma. A slow push over 5 to 10 seconds improves absorption. If your protocol requires aspiration, do it briefly. Most current guidance does not, but follow the prescriber. After injection, withdraw smoothly, apply gentle pressure with gauze, and avoid vigorous massage unless advised. Finally, place the uncapped needle into a sharps container immediately. Note the dose, lot number, and site in records, and if redness, severe pain.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.